Welcome. Have you ever heard of a condition called tympanosclerosis? It's a fascinating, albeit potentially troublesome, disorder affecting the delicate structures within the middle ear. This video will guide you through everything you need to know about tympanosclerosis, from its causes and symptoms to diagnosis and treatment options. Let's dive in and unravel the mysteries of this ear ailment. So, what exactly causes tympanosclerosis? The most common culprit is chronic or recurrent middle ear infections, particularly in childhood. These infections trigger an inflammatory response, leading to tissue damage and the subsequent formation of hardened deposits. Other potential causes include trauma to the eardrum, such as from surgery or injury, ventilation tubes previously placed in the eardrum for fluid drainage, and even, in rare cases, genetic predisposition. It's often a combination of factors that contribute to the development of this condition. To understand tympanosclerosis, we need to explore its pathophysiology, the underlying mechanisms of how it develops. Repetitive inflammation in the middle ear stimulates the production of collagen and calcium deposits. Over time, these deposits harden and thicken, forming plaques of scar tissue on the eardrum or the ossicles, the tiny bones responsible for transmitting sound vibrations. These plaques can stiffen the eardrum, restrict the movement of the ossicles, and disrupt the normal transmission of sound waves to the inner ear. This disruption is what leads to hearing loss. Tympanosclerosis is a relatively common condition, particularly in individuals with a history of recurrent middle ear infections. While precise prevalence figures are difficult to obtain, studies suggest that it affects a significant portion of the population, especially those who have had ventilation tubes inserted in their eardrums as children. It's important to note that not everyone with a history of ear infections will develop tympanosclerosis, but the risk is certainly elevated. The signs and symptoms of tympanosclerosis can vary widely depending on the severity and location of the plaques. In some cases, individuals may experience no symptoms at all. However, the most common symptom is hearing loss, which can range from mild to severe. Other potential symptoms include tinnitus, or ringing in the ears, a feeling of fullness or pressure in the ear, and, in rare cases, dizziness or balance problems. The presence and severity of symptoms often correlate with the extent of ossicular involvement and eardrum stiffness. Diagnosing tympanosclerosis typically involves a comprehensive ear examination and hearing tests. An otoscope, a specialized instrument with a light, is used to visualize the eardrum and identify any visible plaques or abnormalities. Audiometry, a hearing test, helps determine the extent and type of hearing loss. Tympanometry, another test, measures the movement of the eardrum in response to changes in air pressure, which can reveal stiffness or abnormalities. In some cases, imaging studies, such as a CT scan, may be necessary to assess the extent of ossicular involvement. While there aren't strict classifications or distinct types of tympanosclerosis, it's often categorized based on the location and extent of the plaques. Tympanosclerosis can affect the eardrum's tympanic membrane alone, the ossicles' ossicular chain, or both. The extent of ossicular involvement is a key factor in determining the severity of hearing loss and the potential for surgical intervention. Treatment for tympanosclerosis depends on the severity of the symptoms and the impact on hearing. In mild cases, where hearing loss is minimal, no treatment may be necessary, and the condition can simply be monitored. For more significant hearing loss, treatment options include hearing aids to amplify sound and improve audibility. In some cases, surgery may be recommended to remove the plaques and restore the normal movement of the ossicles. A procedure called tympanoplasty can repair the eardrum, while ossiculoplasty can replace or reconstruct damaged ossicles. The choice of treatment depends on the individual's specific circumstances and the extent of the damage. Unfortunately, there's no guaranteed way to completely prevent tympanosclerosis. However, reducing the risk of recurrent middle ear infections is crucial. This can be achieved through measures such as prompt treatment of ear infections with antibiotics, avoiding exposure to secondhand smoke, and ensuring proper hygiene to prevent the spread of germs. For children prone to ear infections, preventative measures like the pneumococcal vaccine may be beneficial. Early intervention and management of ear infections are key to minimizing the risk of developing tympanosclerosis. The prognosis for individuals with tympanosclerosis varies depending on the severity of the condition and the effectiveness of treatment. While tympanosclerosis can lead to permanent hearing loss, many individuals can achieve significant improvement with hearing aids or surgery. Ongoing research is focused on developing more effective treatments and preventative strategies for tympanosclerosis. Some studies are exploring the use of medications to reduce inflammation and prevent plaque formation, while others are investigating novel surgical techniques to restore hearing function. With continued research and advances in medical technology, the future looks promising for individuals affected by tympanosclerosis.